Hello, welcome to Power Hour today, in which we're going to be covering some running technique errors and kind of running faults, and in ways in which these can cause injuries and things we can do to prevent them, not only to stop you getting injured, but also to improve your running performance. So this is a really good show for anyone who's an active runner looking to increase their mileage. I guess we start with an introduction. Dara, if you want to introduce yourself.
Hi, my name is Dara Curran and I've worked with Andy at Perfect Balance Clinic. I've been working with professional athletes since basically 2014. Started in American football and then moved over to Olympic track and field athletes. And I now currently split time with a small group of elite sprinters, hopefully eyeing up next year's Olympics, at PB as a physio. And then also I coach a small group of juniors who are hopefully going to be elites someday. So running, sprinting is basically my life. Hopefully this is kind of my area of expertise.
As for myself, my name is Andy. I'm a physiotherapist at the Cambridge Clinic. My background is also kind of in running injuries. I previously worked as the sports rehabilitator for the Trinity College Athletics Club. Currently, I'm working in one of our clinics, which is situated in the gym. And a lot of the things we're seeing now, particularly after lockdown, is running-related injuries. So for today, the plan would be to speak a little bit about what I'm seeing kind of at the end stage when people are coming in after they've hurt themselves, and how that manifests in their running, and then kind of bounce a few ideas over to Dara to kind of things we can work on technically to either prevent this and improve this. So if I kind of start off by kind of saying what I'm seeing now, particularly after lockdown, a lot of sore knees. People who started running, have not run either before or not run as much, have started to either take up the sport or increase their running load. A lot of what this comes down to depends is I'm seeing a lot of knee injuries and I'm seeing a lot of hip injuries. The most common of which would be runner's knee, patellofemoral pain, which is an irritation behind the kneecap, or lateral hip pain, glute knee tendinopathy. Completely depends, and it tends to fit around two different things. So it's very hard to pick out is the running causing this, or is in terms of is there something in their technique that causes the injury, or is there something that is physiological in their strength or their power that causes the movement to be a little bit non-optimal, and that's when they get their pain. As I see clients in the clinic after they already have pain, it's difficult for me to kind of figure out whether it's which comes first. So that's kind of what we want to speak to you about. And with both of these, it tends to fall into two categories really. The clients I see with the knee pain, they tend to do what we call overstriding when they're running. So when we get them on the treadmill, get them running and doing some functional movements, what I see is particularly the injured side tends to overextend in relationship to their center of mass. So you see what looks like a larger step on the injured side compared to the uninjured side. That does two things. When you overstep on the side, the angle of your foot to your hip changes slightly, and your quadricep muscles actually apply a braking force so that the foot hits the ground slightly harder. And what it does is you can't propel you forward as much, so it actually slows you down a little bit. So what you see at the front is a bigger step, and when you see the behind when the leg comes back towards the backside, is that the leg isn't coming to the side. So somewhere within that movement from the foot hitting the ground to the foot swinging back, they've actually lost some momentum and power. So what's happening is the movement's not optimal. So you'd see a shorter swing back and a larger step to the front, as opposed to the uninjured side, which would be a lot closer to the body when the foot lands and a lot higher swing in the back when they step through. In terms of the hip pain, what I'm really seeing at the moment is a lot of excessive hip adduction. So a kind of crossover gait. So when someone's running, the uninjured side is nice and straight, and then the injured side swings over and almost crosses the middle of the body. With the hip pain, that's one of the things that can be really aggravating the hip pain, and that tends to be one of the things that as people improve and their symptoms get better, that tends to reduce down. But also working on both of those things has been really, really effective. In terms of your technique side of things, Dara, what do you think contributes to that in terms of someone's running movement and mechanics?
So it's complicated because you don't know if it's the chicken or the egg as to how they're presenting, overstriding, that valgus movement you described, which is when the knee basically comes towards the midline as they cross over. So the question is, did that always exist there and has precipitated the injury? Is it a muscle guarding effect as well? Because a lot of runners, like runner's knee isn't like an Achilles tear or any kind of a ACL tear, something that's big and obvious and often happens in a moment in like a contact sport or in non-contact sports like basketball. It's something that's brewing over time and has kind of been niggling at them for a bit, and then it's just debilitating over time. So where you've potentially see them and then they're starting to make these kind of mistakes or whatever nomenclature you want to use, these biomechanical faults that deviate from what we would consider a normative or theoretical ideal, is that because they actually hurt themselves. So they're doing weird stuff to try and problem solve either the limb which is hurt or the contralateral limb. Or did it precipitate the injury, and has it been a central driving force? Like, is that adduction that you see before ground strike, is that causing the knee to be somewhat unstable? Is it overloading one segment versus the other? Like, are muscles contributing not only appropriately strength-wise, but in appropriate timelines? Like you said, the braking forces with quadriceps, like each of these muscles has a part to play in every part of the cycle. So is it kicking in at the right time to apply those braking forces to set you up for the next step, or are they always dumping on every step and kind of really landing and crashing with every single step? Because if you imagine that every time, so sprinters roughly apply 5 times their body weight on a single leg. I think joggers, it depends on your speed, but it'll be at least twice, potentially 3 times on a single leg. So that's quite a lot of force to be absorbed if you've got a biomechanical fault. But also it could be just that it's a combination. Basically, it's a combination of those two things. So it could be biomechanical, and biomechanical is what we see in clinic. So we have a tendency to pick those things out. But there's, if you imagine that you never saw this person, you never saw them run, you could still do probably a pretty good job of rehabbing them by addressing low-hanging fruit. So are they strong? Probably not. A lot of runners don't have a cohesive, intelligently structured strength program that's appropriate. Do they have a warm-up? Some people's warm-up is just to jog around in bits and pieces. Like, it's unlikely that if that's all you're doing, you've really set up your entire lower limb, upper limb, everything to stabilize on a single leg under the forces you're going to expose yourself. And the other part of it is, if your warm-up is jogging and your running is jogging and all you're doing is running, basically, you're bound to get overuse injuries because there's almost zero movement variability in your training program. Like, if you look at the pro programs, it's vast, it's diverse, and they are like the professional athletes, and they train 4 or 5 hours a day. So it's going to be bigger. But what you'll see if you pick out pockets is how much of the time they spend sprinting, how much of the time they spend in the gym, how much of the time they spend doing remedial exercises, things that look a little bit like yoga with a little bit more strength work, basic stuff that probably looks like it was taken out of HIIT classes, squats and bits like that, to keep them hale, healthy and hearty. And if that's not part of the running program, that's an error, because basically all you're doing is running. And if all you do is run, at some point, you're going to pay a price for it. So we've kind of covered strength work. The warm-up's really, really important. It should be have a lot of movement diversity, come from kind of different lanes. So you want an active torso, you want the medial chain to contribute, that's your adductors primarily. You want your core to be active and strong before you go out running. And you also just want to be quite warm, because we're now heading off into colder months. So it's good to have a warm-up. The way I build mine in clinic, which is obviously different than at the track, is 10 minutes of stuff that they do inside where it is relatively warm before they head out. And then they do more run-specific stuff. But the first phase is actually ground-based. And it's just a series of activation drills for key muscle groups that are going to be used in the following. And then they go out and they do some movement drills so that they're cueing the things that we see biomechanically. So we're attacking things from both physiology and biomechanics, such that you're not missing the chicken or the egg, because you don't actually necessarily know which comes from which. When I started out, what you read is biomechanics. You want things to be absolutely perfect. But I work with professional athletes. I work with one guy who pops to mind immediately, who is, like, movement-wise, very unusual. He presents in such a way that most physios in the clinic would be like, Jesus, like, that is very surprising that this person can move this fast. quite internally rotated at the hip, quite externally rotated at the tibia. But he's healthy, hale and hearty, and he's moving fast. So he's got a lot of biomechanical faults, but he can still run fast because the program is set up for him to succeed. We've activated all the key players. He's got good therapy, hopefully, on the side as well. And then the program fits his balance. So you kind of want to apply that professional approach that you take to athletics to general population runners if you want to be successful and have them be run fast and most importantly be healthy. So you don't want to miss any of these phases, because you can be biomechanically faulty and still do well if the program's set up. But physiology is good and biomechanics isn't perfect, you can kind of get away with it if you're pretty intelligent. If biomechanics is really good, your physiology has a bit more room to make mistakes. And if you get both going, you're likely going to perform quite well. But if both are falling down, then you're likely going to feel something at some point. Like you said, you get knee, you get hit. Like, those injuries are showing you the chink in their armor. They're not necessarily indicative of what running does, if that makes sense. Like, it's not that running causes knee or running causes hip. It's because that's where they've got an inappropriately set up framework to go out and train, and then they expose themselves and they feel it in one or two places because that's where their system is set up to fail. It's not necessarily as simple as glute med tendinopathy, let's start to rehab that, treat it purely locally. It has to be looked at holistically, like from the perspective of take 10 miles back. Are they warming up? Are they strong? What is the balance of training? What is the thought process behind training? One of the nicest success stories I have is that this lady was training for, this is in clinic, for a multitude of different events. And she'd come in and we kind of fixed what was going on with her ankle and sent her off. And then she came back, and maybe 6-8 weeks later, which would be very unusual for someone to come back quite quickly after having because I make sure that all the steps are in play for them to hopefully go off and have quite a successful long period with no injuries. And she kind of came back, and I said, there's nothing wrong mechanically. There can't be. We've addressed that from every quartet. We've ticked the boxes of strength, elasticity. Let's look at the program itself, how it's set up. And she was working a lot. She was training 5 days a week, very hard. So what we did is, for 2 weeks straight, she gets to train her 5 days a week. And on that third week, she is allowed to choose which day she wants to take off, but she has to take at least 2 days off. And she texts me or emailed me maybe a month afterward that basically she PB'd on every single testable event by a significant margin. She just needed rest. And sometimes that's the other side of the pendulum, is that people go back to running. They run. They don't actually think it's a lot because they used to run a lot more than this now. It feels much less to them, but actually their system hasn't been exposed to it in a long time, and it's just going to trash them with DOMs early. And if they try and run through the DOMs, they're going to run oddly or bizarrely. They're going to create more biomechanical variability within their run, which isn't necessarily always a bad thing. But in this instance, if you're having muscles that haven't been used in a while or are not very familiar with that pattern being used over and over again, they're going to start to develop an aberrant pattern and potentially expose themselves to some sort of injury or picking up some sort of malady that then propagates again and again and again. And that's how you get that patellofemoral pain, or those kind of longitudinal running injuries, which is usually the way running injuries are. Unless you trip, go into a pothole or something like that, they're usually things that have been brewing for a significant period of time.
I wanted to ask you kind of mentioned there, and this is something that I've noticed an awful lot, and I think it comes from general training and advice of what's optimal. And I think what's optimal for certain constructs, as in what makes you stronger, what makes you build your muscles, might not always be the best thing for you. So certainly what I've my background in training and looking at is that people tend to get put on these programs that are too much for them. And not to say that we shouldn't be training like elite athletes, we should be. And what you'd find is, if you looked at a high level club, they wouldn't actually be training this way. So what they found is high level, particularly anyone in any sports, so basketball, football, and sprinting. So anything where someone has just a high volume of one sport, they of course need to maintain a certain level of strength by cross training in the gym. But what they actually find is, certainly in season, the less work they do in the gym, the more rest they have, the better they perform on the track or on the field. And that has to do with what you're saying. We get tired, and the more effort we put in, the more we work, the tired you get, and that's when you start to kind of see these falls. I think a lot of people just need to kind of have a look at what you're doing and say, you know, is this too much for me? What is the most important thing? Is running my priority, or is getting stronger my priority? And balance between the two of them. I would say, as a general rule for most people, if you are trying to get stronger and you are running a lot, is look at what you're doing strength based in the gym. Half the number of reps you do and double the sets. So give yourself twice as much rest. You'll feel better. Your running won't be as effective. You won't get those DOMs, and hopefully avoid some of these kind of technique errors that we're seeing kind of late stage that are coming on with, yeah, like you said, fatigue and tiredness. No one is taught how to run. We know how to do it inherently. So no one starts off with, you know, a kind of bad technique. And if you watch kids run, they run, you know, they run fine. We don't have to teach them. Certainly, if you stop for a while, your body needs to have a few tweaks and a few of those drills that you do. And before we kind of talked, before we went on, you mentioned that one of the athletes you work with actually runs with quite horrible technique.
It's pretty questionable. They call them out and say that, but it deviates from a biomechanical standard that you would find in any book quite aggressively.
Yeah. Well, then, you probably know more of this than me, but Usain Bolt with his scoliosis, he deviates from the norm as well. He strides further on one side and then the other, and he rotates slightly. He's certainly running a lot faster than any of us
will ever probably do. Usain's actually kind of a good case study because he runs fast with scoliosis, but it's kind of chicken and egg again. There were phases in his early career where he was laid up and couldn't race because they hadn't yet figured out exactly how to manage it. I think that's where the kind of skill of therapy and clinical physio for runners is you're going to see biomechanical faults. You have to kind of decide and figure out, and it takes a patient load to figure that out, and watching a lot of video, exactly how much you can tolerate of that kind of like midline adduction. How much can you tolerate that overstriding? Because that's why I look at it from the more macro perspective, because I know if I take all these low hanging fruit and send them off and then they're still struggling, then the biomechanical stuff really, really, really is key. But actually often you find that when they've quite a well set up program, that stuff starts to, the bandwidth of that error starts to kind of shrink down. They basically don't look as odd, as weird, as off when they run, because they're active in a different way. Like people sit all day and then get up and run. That means that the tone of their hip flexors, which may actually still be weak as opposed to strong, will be high. They often externally rotate, meaning that their glutes will be not necessarily strong, but quite tight and limited. And then the medial chain, the adductors, I see an awful lot, pretty much off, not a major contributor. And if you imagine that you're getting glute tendinopathies on that side, that's basically a steering mechanism of that leg on each stance. You want a balance of what's happening at the peroneals. That's one of the small muscles of the calf and ankle, what's happening at the adductor and what's happening at the glute, to kind of match each other to create a stiff, stable base with every single step. And if you've actually got that the adductor contributes very little, or it contributes too late to really catch you, then that glute is just going to try and steer. And it's miles away from where it's contacting the ground. So it's steering a really, really long lever. And it's going to get overloaded, and you're going to get some kind of an issue out of it, if that makes sense.
If we kind of discuss, well, I guess what we do about it really is I guess what people really want to know. If someone's caught themselves in the mirror, or maybe taking a video themselves, what you always recommend is to video yourself and look at it. If they see themselves overstriding, or they see any asymmetries in their running or slightly different technique, how do you normally start to look at fix these and change these? Not necessarily saying that they have to be. I guess that's one of the most important things. If you don't have any pain and you're running what you feel is comfortable with technique, it's important not to be over kind of aware of what you're doing. But if you do have, let's say, some pain on that side, and you are noticing something slightly different, and if you're coming to see myself as Dara in the clinic, these are the kind of things that we probably try to work on. So where would you start with someone who's noticed that they they do have a slightly different stride on one side, and they're getting some pain on that side.
So basically, if anyone comes to see me, they're hurt. So in clinic, I'm not a coach. But I am towards the back end, I suppose. But my primary position is physio, guide them through the process, and then kind of release them off to run. So the first step is they're sore, and I want to take some of that pain away. So I do a lot of hands-on stuff to try and approximate that neutral, inverted commas, that I don't necessarily want to see. But like I said, if they're miles outside of a kind of a normative bandwidth, which they'll often be either because of pain or as a cause of pain, we don't know if that's the chicken or the egg, by bringing them a little bit closer to that kind of normative position, as well as testing them the whole way along, you can kind of figure out what your central drivers of pain are, at least, even if they aren't necessarily the reasons that they got hurt in the first place, if that makes sense. So you can solve the first half of the problem, as well as get the patient to be like, oh yeah, this is fantastic, this is clear, we're clearly on the right track, and you can kind of problem solve that yourself. So then you've kind of pinpointed what's going wrong. Like, are they just rotating nuts through the lumbar? Is that why they're adducting across the midline and why they're exposing that knee? Because then if you actually just get some stiffness in the appropriate areas and some release in the areas that are tight and strung out and overloaded, you can usually take a pretty big amount of the pain away quite quickly. Not necessarily all, and it's kind of short term, but it gives you an idea of where to aim the boat. So the first step for me is usually isometric work, because that's going to help with the pain, help interrupt the pain loop. It also kind of sets things up if there is actual tissue damage, collagen damage, that the collagen is laid down in a direction reflective of the force that's exposed to, because we know collagen is at least partially mechanosensitive. So the direction of force is really important. If it's going to be injured and scarring, we want it to scar in a direction that works for us, not like, you know, when the cat used to get into a ball of string, it's all over the place. We want it aligned with the forces it's going to be exposed to. We want it in line, in sequence with the hamstring or whatever muscle it is. So it's a contributor as opposed to a block that's going to really, really struggle to move that entire chain. Once we've got them through a series of isometrics, the next step is usually to start looking at loading. And so I look at loading as one of the most important things that we need to do is fill a strength gap, because people go from running and being kind of fit and a certain type of strong, not a classic gym strong, but they have got tone and strength and different muscles that they've overused a little bit, but they are still strong. You don't want to waste that. So you want to step in as quickly as possible to conserve, because let's say someone's out of running for 6 weeks, and more often than not, actually, it's longer than that. You want to fill that gap because you can get a ton of atrophy, you can get a ton of muscle loss in that time frame. You can get a ton of range of motion loss in that time frame as well. So you want to step in and actually fill those gaps. And the other thing that's really important, and I've noticed that it's really, really stark, that the ones who are really successful in clinic, I give them home cardiovascular work to do. So either on a stepper or on a bike, just push themselves. It looks pretty similar to like high intensity interval training. It's just a way to literally push their physiology, push adrenaline high levels, push beta endorphin high levels, get some pain blocking response. Even if they're injured on one leg, I'll get them to do it on just the other leg. And I know, because I've been doing this for a while, both with athletes who you'll be able to make do it, and then patients who are not always as easy. That those who go away and do it, they shorten their timelines by miles. Like, they're really, really quick to move through phases. Like, it sometimes surprises me how quickly they move through phases. And then those who you come in and check in, you're like, have you been doing your cardiovascular work? Then they haven't, or they've been too busy, or for some reason that it wasn't easy for them to get that done. They're going to be slower. It's going to be harder to get them to respond. Like, ticking low-hanging fruit is probably one of the most important things that I've figured out over the years. That's gonna give us relief. So that kind of exists in the background throughout their entire 6 weeks. So at least when they're exposed, their fitness is actually, sometimes it's improved, not specific fitness obviously for running, but actually their fitness themselves, because they're on quite a regimented schedule if they adhere to it. For 6 weeks, they often can find themselves quite fit and able. And then you start to look to fill strength gaps. Ones that are pretty general, like what does a runner need? Well, they need strong and capable hamstrings, glutes, feet, quads, um, and adductors. Like, as long as a lot of that, and basic core strength as well to tie it all together. But as long as a lot of those basic boxes are kind of ticked, and you can tick them in running specific manner with isometrics under a Smith machine, you can get really fun with it if you wish. But basically, big broad basics. Those who strength train appropriately. Like, you can end up causing more trouble than you're worth if you actually just have them squatting noon, night. Just like you said earlier about an inappropriate strength program. There's no need in most instances to actually push for these super crazy programs. Very simple, very basic, but comprehensive is usually going to fill a big gap. And the other thing is, because they're not running, they have that energy to spend. That's free money that you can throw at gym and use 6 weeks to get them really strong and capable going back into it. And then not only are they strong going back in, but it's really easy to maintain strength. Like, I've known it's almost ridiculous how easy it is to maintain strength. You can train once every 9 days if you're already strong and still maintain quite a high level of specific strength and tissue quality. It's not ideal. You want to maybe train a little more frequently, because you'll notice that session every 9 days is going to be so heavy that it's going to kind of knock you out for a couple of days. But maintaining strength is much easier than gaining strength. So by the time they return to running, they're strong and they're also experienced. They've done 6 weeks of good, high quality strength training. They know what it is. Their bodies are familiar with it. They're toned up. They're ready to go. And throughout that period, I'm just choosing 6 weeks as hypothetical. It can be longer, shorter. And throughout that period, what I'll start to do is bleed in what running they can tolerate. So whether it's a dribble series, which I think I've shown you, I know you'd use a lot of the A and B stuff. So basically, what I do is I take what will become ultimately their warm up, and I kind of hyperdose it. So it's running specific drills that I'll dose them week on week, what they can tolerate. They learn how to contact the ground appropriately, how to move elastically, what symmetry and what running should really feel like, instead of kind of a dumpy, squatty, push through it kind of a thing. They become more upright, more bouncy, more athletic, for want of a better word. And that's what I'll use to kind of tease them up. And instead of saying you're going to be ready to run in 6 weeks, 8 weeks, which I don't think anyone actually does, I shouldn't say that out of hand, we'll pass landmarks. Can you do this effectively? Yeah, then we can move on to the next phase. Are you pretty elastic? Like, does your elasticity in jumps hold up longitudinally over the course of a sequence? Can you jump forwards and backwards? Like, if you're missing backwards. So the biggest one of the best things that I learned from my mentor Dan Paff was who doesn't get hamstring injuries in the NFL? We're a super high velocity contact sport. So it's defensive backs. They move backwards all the time. They move backwards high and they move backwards low. So moving backwards is really, really important. Moving in multiple directions is really, really important, especially if you exist in a sport like running, which is basically just moving forward all the time, or around the track, which again creates its own asymmetries and a complete lack of movement variability. So you basically just want to plug in those bits progressively, watch them succeed week on week in ticking off those boxes until they're basically a pretty well-built running machine that you can kind of let off. And then when ultimately do say goodbye and wave out the door, I also send them off with a program that's kind of appropriate for their level. I think it's about 8 weeks long, and there's just kind of charts through, because like I said, one of the most important thing that we had with that lady who I spoke about earlier was giving her rest. Because sometimes because I think actually that was a lesson that was learned the hard way. Sometimes you send them off and you don't have enough direction about running, kind of give them a looser idea, but actually having something written, focused, is really, really helpful for them to not over push. Because it's very tempting when you've been given the get-go, and then maybe you're part of a club, to just run and gun and totally go for it, and then you come back to see me. So send them off with a program that is specific to their needs, and it's also long enough to see that it works, if that makes sense. It's not just 2 or 3 weeks, it's about 8, I think, is what I have there, with some check-in points along if they're not feeling perfect or they're worried something's cropping up, so that we really, really know we've built the machine, and then we've stress tested it across 8 weeks in a good solid program with strength work. We know that like you're ready to run and hopefully perform as well as enjoy and all those basic things, if that makes sense.
I guess we're very similar. You're a lot more technical with it, and you have a deeper understanding of the running and techniques that come along with it. But I think I'd be the exact same in the clinic. If you have pain, that's going to affect how you move. So the priority is always try to settle down the tissues that are sore, and that will affect your movement. One of the things that I kind of find is people are very focused on the movement side of things. If we can get the pain to come down a bit, you can affect how people move. I always go from the same kind of approach as you, is load the tissues that are sore, because they're going to be the things that affect the movement. And then if there's any way on our running that we can offload them, we'll try to do that. And one of the things that I've come across is altering cadence as well. So it's a kind of easy way to kind of monitor yourself. See how fast you're running. So as you run, make a note of how often your feet hit the ground and what sort of beats per minute you're doing. If at that cadence you have pain, then we can change that slightly. So what I encourage people to do is add an extra 5% to their cadence. So if you run at, I'm going to have to do maths in my head there. For example, if you run at 100 beats per minute, if you run at 100 beats per minute, take smaller, quicker steps. Don't want to jump it up too much, but basically add an extra 5 beats on, to add an extra 5% per minute. So what that will do is very, very slightly change your biomechanics in the way that should offload things slightly. A lot of the smartwatches do have cadence on there, and you can get a metronome on your phone to monitor it. So I'd always look at how quickly your feet are moving, and that's one of the kind of cheats we can do, is get you taking shorter, quicker steps, and that should help offload very, very slightly as we work with the strength work, like Dara was saying, to get things to be a little less sore. One thing people can always say to me, and it's probably a pitfall of a lot of therapy and certain things that I was taught when I first graduated, is that exercise will change your biomechanics. What I found in people, particularly without pain, because that's where the mistake can come in. If someone has some pain and you exercise it and you get those tissues that are sore to be a little less painful, that will change your biomechanics. So in a way, you've changed it through exercise, not through strengthening, but by exercise's effect on pain. If someone doesn't have any pain and they have those movements, exercise is not very likely to change them. So what I always suggest to people, and a lot of the run retraining stuff that's coming out of even some of the English universities, is they talk about what would be cognitive rich rehab. So have people thinking about how they're moving, and have people focusing on their foot position and run retraining that way, seems to have a better effect on your movement than opposed to just getting stronger in X muscle and stretching X muscle, because we all learn to move and we have that movement pattern inherent in our head. So another thing what I tend to do is when we get the drills in place that you've discussed, that kind of reinforce, optimal technique, high hips, high dorsiflexion, and good foot landing position, nice arm swing, have them incorporated into your running. So use them as a drill. Warm up, get the movement ready, so find the movement, but also when you're running is to be aware of those things. Obviously, I don't expect anyone to run for an hour and maintain optimal position, because a lot of people run to clear their head, get out, escape. So what I suggest is every 5-10 minutes, every kilometer, certain points during a run, map them out for 30 seconds to a minute. Think about that optimal technique. Think about those drills like I do, the A skips, the B skips. Think about your chest position. Think about your breathing. Do you feel comfortable where you are? Is your head in a good position? Have you slouched forward? And just for a minute, 30 seconds, run with that good technique and then forget about it. So teach your body that it feels good to move certain ways, and then try to incorporate that into your running as well. So don't always have to hammer home the strength training. If you have some excessive abduction in your hips, if they're not sore, working your glutes an awful lot is not going to change that. You do have some hip pain, and getting some loads from them can really influence it. I think the last thing that we kind of talked about before we started that we haven't really covered is what really makes a good warm-up. A lot of the people that we're seeing in the clinic now are people that have just started running. They haven't given too much thought about it. It's like, I need to do it, I need to run. They're running for different reasons other than running. They want to get fitter, lose some weight, get stronger in general, try exercise for the first time, it's probably the first thing you've done, literally gone out, popped the shoes on, and just started hitting the pavement. What do you encourage in a good warm-up? Because you did talk about this a lot, and it's something that we always spend a lot of time talking about in the clinic. I think a lot of people would benefit from kind of hearing what you would encourage as a good warm-up.
I kind of flit and flute between what I think is the most important thing, but warm-up is definitely right up there because it not only is a time to teach and to key into critical running postures that they're hopefully going to use when they're exposed, but it's also the time to prepare the body entirely for its test. So what makes a good warm-up? It needs to be comprehensive. So I go through a series of torso activation drills, then dynamic flexibility, then dynamic mobility, and then go into sprint drills, and then some sprint-specific elasticity stuff. And I've used the word sprint drills, but it may as well be running drills. It's basically just drills that reinforce certain postures, and all that changes between runners and sprinters is that the angles are slightly shifted, but the same themes should be there of dorsiflexion, appropriate context on the ground, elasticity, things like that. And then if you shrink into what each one means, so let's go to torso activation. You want to make sure that so dorsal activation is just kind of a byword for appropriate core musculature, strict kind of toning up of the central of the most important muscles which are going to be used in the succeeding run. So basic core stuff, which some people will be thinking sit-ups, blah, blah, blah. What we're kind of looking more at is actually activating in stuff that kind of looks similar to sprinting postures, sort of. You want that kind of classic pillar position, tall all the way through. And then, obviously you sit in plank, you're working through the anterior chain. But what we'll kind of go through is plank, side plank, and then kind of what's a reverse plank, something that was stolen from one of the running specific circuits. So we basically just want if you imagine like the way bodybuilders look at their bodies, and they want every single muscle to be big and strong. Similar enough in when you're building out your warm-up, you want every single muscle which is going to be used to be tonic and active and ready to go. So torso activation kind of takes that approach. It looks at medial chain, posterior chain, anterior chain, gets them all active in different ways in precedingly more dynamic ways. So we move from static stuff like planks to more dynamic stuff like push-ups, which is basically the anterior chain, but now you've rolled through the entire shoulder girdle, stressed and activated pecs and different things, and also you've got more movement, so there's now more blood flow. So by the end of torso activation, you should be ready to proceed to dynamic mobility drills because you're warm, you're active, you're appropriately tonic, which is very general for the sprinters or the juniors or whoever I'm working with. But let's say it's with runners who are returning, that can be a chance to tone up guys who are really non-contributors. Like I often find the medial chain is the one that I end up targeting a lot because I find that it's low-hanging fruit, really big payoff from success there. So you might want to hyperdose that through torso activation and then see what they look like. And you literally have them in clinic and you're teaching them this. So you will see how they respond to what you've designed, which will hopefully be appropriate. Next step is to move into dynamic flexibility. So that's classic stuff like leg swings, which you've seen, eagle, scorpions, just like gain some range and elasticity through that range. It's all active. I'm not anti-static stretching by any means. I know the literature would indicate that it decreases power outputs, but I actually think that that's in error because a lot of martial artists, professional sprinters that I've worked with in the past have used static stretching successfully. So if that's part of your puzzle and you're used to it and enjoy it, definitely keep that in there. But for me, if I've got, the sprinters warm up for 45 minutes, obviously can't allocate that kind of time to people who want to run. So I basically have to shrink things down quite significantly, but still be really productive. So I want to make sure that what we choose is short, sharp, easy to do, and appropriately stretches while activating the musculature which is going to be used. So it's lots of rotation, lots of flexion, extension, like loads of stuff that you've seen before. But what's important is people kind of think a couple of leg swings or a couple of planks, like they shrink it down and they end up working just one chain. They haven't actually seen the whole picture and they've left themselves weak or inactive, or they've actually continued to drive that process of movement chronicity by just kind of doing the same thing. So it is quite comprehensive, a battery. Then we move into mobility.
In summary, it really comes down to, get yourself warm, get yourself moving a little bit beforehand. Your body will thank you for it.
Easy peasy.
In terms of dynamic flexibility, like I said, there's those options, and that is one of the things that people don't always see. I mean, it's same across all sports. Sprinters are always a little bit excessive for it. Well, not excessive, but they warm up for 45 minutes.
Yeah,
that is a long time. But they do it for a reason. I'm not an elite athlete, far from it, but I will warm up for an extended period of time, and I feel better for it. I feel like I move more, and it's one of the things that when we do get people kind of getting the hips moving, a little bit beyond what you normally do in running, getting the core active, you feel a lot better when you actually get out and do some running. So not only you're warm, you're active, and you're moving better.
yeah.
Is there anything you wanted to go over before we finish there?
Just that we actually haven't touched on dorsiflexion that much, and it's actually one of those things that so I often think about things like this. Like there was a system set up in Leinster Rugby when I went to go visit, and it's basically just a series of very loose tests. They test internal rotation of shoulder, adductor strength, really, really loose tests, and they just print out a number on a sheet, and then they run it through an algorithm, and it gives a correlate towards or a prediction of injury. So I think similarly, dorsiflexion is really low hanging fruit. Like those who don't dorsiflex are way, way, way more likely to get injured. It's one of those things that's like central to running and sets up the entire system. And for people,
the foot position when you come through.
Yeah, people may not even realize what dorsiflexion is. So if plantar flexion is when the ballerina points her foot, dorsiflexion is the opposite. When you raise it all the way up, close the angle as close to the shin as possible. And it sets up a really important chain of events. And basically, one of the most important and obvious things to see is that not only, first of all, a lot of people run not dorsiflex anyway, but when you're in clinic and you have people in pain, they'll be pointing their toes like ballerinas. Like you don't see dorsiflexion in injured people, or I've very, very rarely seen it. And people gravitate away from it sometimes because they've been told to run on their toes, because people have kind of misappropriated what they've seen or heard about running. And sometimes it's just kind of an automatic reflex because they are tight or limited in other areas. But it's just one of those things that if I never saw the person and I knew that they didn't dorsiflex and then they got hurt, I already have an idea in mind of where to start, because that really needs to happen. Like the entire thing is basically set up based off how the foot contacts the ground. And if the foot is not prepared to contact the ground by dorsiflexing, you're going to get forced absorption that is less than ideal somewhere. And if you're doing that every single step for many, many miles, the odds of something happening definitely vastly increase. So that would be the last kind of big sign-off point, is pay attention to dorsiflexion.
Get the toes up. Toes up.
Toes up.
I hope that, like I said, I feel that we covered everything we wanted to, but I hope that it was kind of useful. And if you do have any kind of questions based around your running, or would like to get your running kind of looked at, feel free to contact one of us. And we'll see if we can get our emails added on at the end. But it was a pleasure to bring you this power hour this week, and all the best with your running in the future. And thanks, Dara, for talking through some of the more technical side of running that most of us physios wouldn't get to experience.
Lovely to be here. Thanks, Andy.
Bye, everyone.